welcome. And if we go straight into the presentation, are you recording now?
I am recording now, yes.
Okay, great. So thank you very much. As we said, it's great for you to get to this point. So tell us about your wonderful idea, because that's why we're here, to hear about that.
Okay, thank you so much. My name is Tafadzwa Sachikonye. I'm from Zimbabwe, specifically Harare, where my project is going to start. It's a wastewater project specifically, and it focuses on a management of wastewater in urban areas that are congested and water stressed, such as Harare. So initially, I'm a global citizen at the Ban Ki-moon. I'm also focusing on SDG 6, Target 6.2. So I realized that a lot of projects that are done in the area which I'll be focusing my project on. We have projects that are running under WASH, but they focus mainly on providing water, but there are no projects that are focusing on the management of wastewater. So with regards to wastewater, in Zimbabwe, it doesn't really have much recognition because, you know, it's still regarded as waste. And so I'm trying to portray it, bringing out the resourcefulness of wastewater that can be utilized. So that's why I suggested that I would be using wastewater for water surveillance, to detect pandemics or viruses such as COVID. So those are some of the things that will attract people to give attention to managing waste. Then considering the area that I'm doing my project or that I'm focusing on, there is now, because of high urbanization, we now have people who have got who are using sewage systems and others who are using waterless systems or even practicing open defecation. So the disposal and treatment of wastewater is not coordinated because we have in the same area people who use flush toilets and others use pit latrines and others just dispose their wastewater in the open. And so my major aim is to first to educate people on why it is important to manage wastewater properly, especially when it comes to its disposal and collection, as well as its treatment. The benefit comes with it will be reduced waterborne diseases, which has been another major challenge which we are facing here in Zimbabwe. We have 4,000 people who died in the area that I'm focusing on due to cholera as well as typhoid. So this also has been caused by the city council not being able to manage water supply as well as treatment of water. So the project also aims to make sure that wastewater, like the management of wastewater, is decentralized so that it doesn't have to solely rely on the city council, because I think right now they are not in the capacity to hold or to be able to deliver the management of wastewater to 5 million people that are currently residing in Zimbabwe. So firstly, as I've mentioned, I'll be conducting educative sessions to the community so that people will be aware and will be willing to engage as well as participate in ways which they can manage their wastewater. And then we'll move on to finding solutions which the community will be comfortable in adopting so that they can manage their wastewater. So I'm targeting for the first phase of my project, let's target 4,000 people in the area, and then we'll increase as time goes. And okay, thank you.
So I'll interrupt and we'll start asking you questions if that is okay.
Okay, that's fine.
So what brings you personally to this project, right? What means that it's a particular passion for you?
Okay, the main what brought me here is because I also grew up in that same setup where we grew up as children getting used to wastewater, but it's then really got to my heart when we started having water challenges, and then we'll go to nearby wells, open wells that had contaminated water. So that then stirred up my passion to follow this project.
Okay, so that's your own personal experience.
Yes, yes.
Yeah. And how is this particularly relevant for the COVID situation, this project?
Okay. I believe that it is relevant because in urban areas, okay, in Harare, it's a city that is water stressed. So we have people going for fresh groundwater, but the water is not enough. So, and then we have got water that is used, but it's not being treated well. So if we can recycle the water, it means that there will be a reduced stress on the groundwater that is available. And I think also it can be an added advantage if we have coordinated wastewater systems, so we can manage things such as COVID testing or regulating regulation measures during COVID. I believe that in the UK, there are some municipalities that are using wastewater, to keep track of the viral load in a certain community. It's not exhaustive, but it's something that can add to in terms of policy making during the COVID on determining when to ease the lockdown.
Yes, I think there are some projects to do with that in the UK. I think they're primarily, of course, to do with sewer systems, but in the same kind of area. Terry, would you like to?
Thanks. Yes, I've got a two-part sort of related approach to the practical application of what your proposal is all about, in terms of you've done some thinking clearly, but and you mentioned about the lack of, if you will, coordination of the council, but how have you perhaps engaged with them? Have you, because it strikes me that, have you thought about working alongside them?
Okay. I have engaged with them, and I'm still in the process of engaging with them. So the problem that we have, I think this is the problem of Africa, there will be funds, but they are then corrupted, So that's the case that is here, that you don't really get things going, you don't really understand what they are really doing. And right now, wastewater management solely rests in their hands. So I would want to work with them, but not implementing the project in their name. You get what I'm saying?
I
will be,
understand.
yeah, it will be more like partnering with them so as to improve transparency and accountability of the whole process.
Excellent. Yes, so this takes me back to the other part I was also very curious about. You want to talk to communities and agree an aligned approach. Have you already started that in any respect, to test what kind of activity would enable this to actually happen?
Okay, I have started engaging with an NGO that has been doing tremendous work of providing water in the specific site that I'll be focusing on. So they are going to help me with communicating with the larger part of the citizens, since they have already been in operation for about 10 years now, focusing on water. So yeah, that's where I'm going to start. Start with that NGO, and then use some of the information that they have, because currently as well, the major challenge that I had been facing was the lack of data on water, specifically in Harare. So the data is, you find more data with NGOs and no data with regards to wastewater with the government. So yeah, I've just engaged one NGO that's working in that area.
Okay, Mike, you're next.
Yeah, I've got a couple of questions. So one based on, if I heard what you said properly, I think you said you were targeting 4,000 people as the starting point. Is that did I hear that right?
Yes, yes.
Okay, and can you give me more of a feel for what made you choose those 4,000? What kind of area it is, how you went about that? Because that would help me to picture it better.
Okay, okay. Okay, for the place that I'm focusing on is called Glenview. It has got 60,000 people.
Yep.
So I saw that for now, for me to engage the whole 60,000 is unbelievable.
Yeah.
So,
yeah.
But the 4,000, I picked it up from the number of cases that were of people affected by cholera and typhoid before. So yeah. So the number has been just ranging between 4,000 or 4.5. That's why I chose that 4,000.
Okay, and are they all in the same geographical kind of area?
Yes, they are in the same geographical area.
Okay, that helps. That's great. My second question then is, again, just to build on some of the stuff that you said as you talked through for us. So my second question is, when all this is implemented, what do you see the top 3 outcomes being? And you'd started to talk to us about education. You'd started to talk to us about helping with the capacity of, because the council can't cope with it all, and you'd started to talk to us all about it being community-based solution and things like that. So just to expand on those a bit more. So what would you see as the really great outcomes when you've got this implemented?
Okay, I think the greatest income would be reduced number of waterborne diseases cases in that area. That's number one. Number two, have improved water access. As I mentioned before, that people now are relying solely on open well as sources of water. So after this project, I think that the water will be, more water will be available for people to use. It might not be potable water, but it will be water that can be used for other things such as cleaning and washing and irrigation. And also, I would see the wastewater being treated as a resource, not fully as waste. I think nowadays we are seeing adoption of wastewater for other things such as extraction of phosphorus, nitrogen, and biogas. So that would be the third expectation for me, that maybe we will see the adoption of other energy sources such as biogas.
That's great. Thank you.
Can you tell me a little bit about the paper-based test kits that you mentioned?
Okay.
Are they for what, specific diseases, and if so, which ones?
Okay, that one, I'm still engaging and investigating more on that. But paper-based testing has once been used to detect other viruses such as the norovirus and polio, I think. And some are saying that for those who have used it, it is cost effective, especially for countries such as Zimbabwe, where you don't have what high-tech functioning labs that you can use to test for virus. So using paper-based to detect the viral load in wastewater would be a bit cheaper for people who do not have access to laboratories.
Okay, thank you. Terry, do you like?
Yes, in fact, it relates to what you just started to follow up, really, in terms of thinking through how would you measure success in terms of you've identified where the issues are, and how would you go about looking at, yes, the impacts are this?
Okay. I think for when starting my project, I'm going to look at the impact that the lack of wastewater management has had before, and keep the records, such as what has been the number of wastewater diseases, what has been the number of people who lack access to water, and how have people been practicing with regards to wastewater, and then if monitor and evaluate if there are any changes with regards to that as the project goes on. And I think you would see from how the people will be carrying around their work there. So I think at first it will be very important for me to have records of what has been happening now and before, so that when I finish, I'll be able to track down the changes.
Okay, thank you very much. So obviously we could talk about this for hours, because it's obviously a serious problem and something that's also very close to your own heart and your own experience. But we can't talk about it for hours, I'm afraid, because we have other folk to see.
Okay.
So you've given us a lot to think about, though, and what happens next is that we will make some decisions, hopefully by the end of the week, and then we will get back to everybody about what happens next and the process going forward. But it's been lovely to speak to you, and I really hope something happens in this area, because it's vital and important work. So thank you very much.
Thank
Thank
you.
you so much for
Be
the
in
time.
touch.
Okay. Thank you.
Bye-bye.
Bye.
Thank you very
Okay.
much. Okay, goodbye.
Thank you. Bye.
Oh. Okay, well, he's gone. Oh, look, he's come back. You're on mute.
Yeah. Are
Okay,
you
so
able
just
to remove them at the end of the call? I wonder
no.
if we should stop the recording for this one now, and then
It's quite useful to just have our conversation recorded,
it
just
means
for
we
us.
will be
No,
late
it'll be
for the
longer.
next one.
You're right.
Yeah?
You're right. Because I was thinking,
We
okay,
No,
it's
we
just that I
chat on
have
the
to.
next call before
Yeah,
they
I know.
join.
What I was going to say is, it's going to be shorter, this one, because it was shorter. But I think we need to get on to the next call in 2 minutes. So once I end the call, though, that's the only time I can convert. So we need to end the call.
Yes, that's fine. do that now. We'll meet you on the next call and
Excellent.
then talk on
All
that.
right.
But we
Perfect.
can't talk on the next one because other people
Yeah,
join us
if they're
because they get
there.
the password.
But we don't
Depends
have to
if they're
admit
there.
them from the waiting room, right? So we
No,
can
no.
talk.
Let's see if they're there or not. Let's have a quick. It'll be a minute. Thanks. See you
Okay.
soon. Cheers.